Hi everyone, this is Dr. Brittany Todd at Sacred Heart Clinical Pharmacy Specialties, and today I wanted to do a video on statin medications. There's a lot of controversy around statin medications. Should I be on it? Should I not? I've heard good things, I've heard bad things. My neighbor says don't take it, just take this over-the-counter supplement. What do I do? So I wanted to talk about what statins are actually used for and what are the benefits, what are the risks, because there are both sides, right? So most people think of statins as cholesterol-lowering medications, which is true. They lower cholesterol, which lowers the numbers that we use to measure cholesterol, things like LDL, non-HDL, triglycerides. Those bad cholesterol numbers let us know that the cholesterol in your body is either high or low. Why is that bad? Well, they found that high cholesterol, studies have shown over and over again, that high cholesterol numbers, which are indicated by these lipoprotein carriers of cholesterol. They're like little taxis that move cholesterol from the liver where it's made to the blood vessel where it gets stuck, basically. And those little taxis are the LDL, the non-HDL, the triglycerides. They all get that cholesterol to the site of action or the blood vessel. Now, that's good. Our body needs cholesterol. We need it for hormone synthesis. We need it for cell wall repairs. We need it for a lot of different functions in our body. So we never want to fully get rid of cholesterol, but especially here in America, because of our diet, our genetics, our lifestyle, most people have way more cholesterol than they actually need. And again, going back to those studies, they found that people who have higher levels of cholesterol have higher risks of heart attacks, strokes, and other ischemic diseases like peripheral arterial disease, mini strokes, the need for hospitalization to get a stent put in your heart. Lots of things like that are the main concern of high cholesterol. Now, high cholesterol is not the only factor that goes into having a heart attack or a stroke. It's just one of the many risk factors. However, it's one of the many that we can fix. If you can fix a problem, let's fix the problem. So here's where statins come in. Statins lower cholesterol numbers because they tell the liver, stop making cholesterol. Stop. Not completely, but as much as we can. So statins in general lower cholesterol anywhere from about 30% to 50%, sometimes even a little bit more, which is great. The goal, especially to reduce your risk of heart attacks and strokes, is to reduce your cholesterol numbers by about 50%. So you'll be actually looking at the LDL indicator of cholesterol. That's one of the little bad taxis that's bringing that cholesterol to the blood vessel and clogging up the blood vessel. So if you decrease the LDL by about 50%, it has been shown to significantly reduce your risk of heart attacks, strokes, mini strokes, what we call revascularizations, which is where we go in and we put in a stent. It decreases your risk of having open heart surgery where they actually have to replace the blood vessel because it was so clogged that they couldn't fix it. They had to actually take it out and put in a new blood vessel. So it's always good to decrease your risk of having open heart surgery, revascularization, heart attack, stroke. Let's not forget that all of those have a risk of death. You know, we live in modern medicine where we see so many people survive heart attacks anymore that it's almost like, nah, if I have a heart attack, it's not a big deal. I'll go to the hospital and they'll fix it. The problem is, what if you have the heart attack that's not fixable? What if you have a heart attack that you drop dead right there? What if you have a heart attack, you go in, you have open heart surgery, and your body can't handle open heart surgery? There's a lot of reasons we definitely don't want you to have heart attack, stroke, all of these other issues. So statins decrease cholesterol, which reduces your risk of having what we call a cardiovascular outcome. Awesome. But it's not just because of lowering cholesterol. You can lower cholesterol with over-the-counter things. You could lower cholesterol with diet, exercise. You could take something called niacin, which is over-the-counter. You can take Cholestoff, which is over-the-counter. You could do all sorts of supplements that have all been shown to decrease cholesterol, at least a little bit, not to the 50% level that statins do. But really the big thing is, why a statin? Why not anything else that lowers cholesterol? statins have a lot of other concerns with them, so why statins? Well, the reason is not only do they lower cholesterol, but statins have also been shown to make those blood vessels stronger, more resilient. So if there is damage that's pulling in that cholesterol to fix it, because that's what cholesterol is for, it's to fix the broken or damaged cell wall in that blood vessel. If it's damaged, you're going to have more and more cholesterol coming in trying to fix it, and that increases your risk of a heart issue, like a heart attack or a stroke. But statins make your blood vessels stronger, more resilient. They're not going to get broken open. They're not going to get damaged like they would if you're not on a statin. So that's huge. Another benefit of statins is that they stabilize plaque. So plaque, picture a blood vessel, and you've got a broken, damaged part of your blood vessel. You've got cholesterol and other things coming in to help fix that blood vessel so that it heals and that cell wall is nice and strong again. So if it does get damaged, it develops something called a plaque, which is good. It's like a scab. If you skin your knee and you get a scab on your knee, it does the same thing in your heart. It's trying to fix that. The problem is sometimes that plaque can be too big in a very narrow vessel, so it clogs up the vessel. Or that plaque can be unstable, meaning it's very thin. It's almost like a very thin balloon that's barely protecting all the stuff inside trying to fix your blood vessel. And if anything comes down your blood vessel that ruptures it, that rupture forms a clot immediately. Your body says, nope, we can't have a rupture. We clot it. And if that clot moves downstream in your blood vessels and gets stuck inside a narrow blood vessel, what do you think is going to happen? It's going to get stuck, and all of the blood after that clot will stop. It clogs up that blood vessel. And if you have no blood getting to the other side of the blood vessel, all of that tissue, and let's say in your heart, all of that tissue dies. It has to have blood because it has to have oxygen to survive. So if it forms a clot, that could drop you. That's called a cardiac arrest. It could drop you immediately if it happens in a large blood vessel, an important blood vessel. Now, if it happens in a smaller blood vessel, that's when you might start feeling some chest pain. You go in, they stent it, they fix it, thank God. Everything's so much better now. But don't you want to take something that prevents this from rupturing to begin with? That's where statins come in. The third mechanism of a statin is to make sure that clot is nice and steady and it's not going to break open and cause that clot. It stabilizes the plaque. And then the fourth benefit of statins is a lot of people are saying it's not cholesterol that causes heart attack. It's not high blood pressure that causes a heart attack, which is untrue. Those are both risk factors. But one of the biggest risk factors that we have heard over and over, especially in the last few years, is it's inflammation. Now, you can reduce inflammation with diet. You can reduce inflammation from a lot of things. But you know what else reduces inflammation? Statins. They decrease inflammation. You can actually see this in blood work. They can check something called a C-reactive protein. And if it's high, it means that you have a lot of inflammation going on in your body. And if it's low, it means you don't. Statins decrease C-reactive protein. We can literally see it in the lab work, knowing that it decreases inflammation. So it lowers cholesterol, it stabilizes or makes your blood vessels more resilient, it stabilizes plaque that's already there, and it lowers inflammation. Again, who cares if it doesn't actually reduce heart attacks? But it does. Studies over and over and over and over again have shown that statins significantly reduce heart attacks, strokes, revascularizations where they go in and put in stents, coronary artery bypass surgeries, those open heart surgeries, and death. In fact, the higher doses of statins do the better job of decreasing these cardiovascular outcomes. So there are 5 huge benefits of statin medications. That's not to say they don't have side effects. That's not to say there's other considerations we should think about. Everyone's different. Some people tolerate one and not the other. There are actually 7 statins on the market for a reason. The reason is some people tolerate 2 or 3 of them and not the other 4. Some people tolerate all of them. In fact, most people tolerate all of them. There are millions and millions of people on statins, and most of them do just fine. The only ones you hear about, and the reason if you Google statins, you'll see they cause muscle breakdown, they cause diabetes, they cause, all these scary things. It's because the only people who write about it are the people who had an issue with it. The other people who are doing just fine aren't going to write and say, I feel great on atorvastatin, or I feel normal, like nothing has changed. They're not going to write about that. So let's get into the side effects of the medications so that we can understand the risks and the benefits. We talked about the benefits. Now let's talk about the risks and how we weigh those in certain patients.